The Pancreatic Enigma, Understanding Late Symptoms, Key Risks, and Treatment Hurdles. Welcome back to HealthSphere. Today we turn our attention to one of the most challenging cancers to diagnose and treat, pancreatic cancer, often detected at advanced stages, understanding its subtle signs, identifying who is at risk, and appreciating the complexities of its treatment are crucial steps in the fight against this formidable disease. The pancreas is a gland located deep within the abdomen, nestled behind the stomach. It plays a vital dual role, producing enzymes that aid digestion and creating hormones like insulin that regulate blood sugar. This tucked-away location contributes significantly to the difficulty in detecting pancreatic cancer early, the silent threat, recognizing often late-stage symptoms. One of the most frustrating aspects of pancreatic cancer is that it often doesn't cause noticeable symptoms in its early stages. When symptoms do appear, they are frequently vague, nonspecific, and can easily be attributed to more common, less serious conditions. By the time symptoms become apparent enough to prompt a doctor's visit, the cancer has often grown and spread beyond the pancreas. This late presentation is a major reason for the lower survival rates associated with this disease. The symptoms experienced can depend on the location of the tumor within the pancreas. The pancreas has a head, body, and tail. Tumors in the head of the pancreas are more likely to cause jaundice sooner because they can block the bile duct which passes through the head of the pancreas. Common symptoms, which often indicate more advanced disease, include jaundice. This is a yellowing of the skin and the whites of the eyes. It occurs when bilirubin, a component of bile, builds up in the blood because a tumor is blocking the bile duct. Jaundice can also cause dark urine, pale or clay-colored stools, and itchy skin. Jaundice without pain is particularly concerning and warrants immediate medical attention. Abdominal or back pain. Pain in the upper abdomen or back is a common symptom, often described as a dull ache that may radiate to the back. This pain can worsen after eating or when lying down. As the tumor grows, it can press on nerves and organs, causing more severe pain. Unexplained weight loss and loss of appetite. Significant and unintentional weight loss is a frequent symptom. This can be due to the cancer itself, difficulty digesting food because of enzyme deficiencies caused by the tumor, or a loss of appetite. Digestive problems. These can include nausea, vomiting, indigestion, bloating, and a feeling of fullness after eating only a small amount. If a tumor in the head of the pancreas blocks the duodenum, it can prevent food from passing, leading to nausea and vomiting. Changes in stools, such as diarrhea or oily, foul-smelling stools, can occur if the pancreas is not producing enough digestive enzymes. New-onset diabetes or difficulty controlling existing diabetes. Pancreatic cancer can affect the insulin-producing cells in the pancreas, leading to the development of diabetes or making existing diabetes harder to manage. A sudden diagnosis of type 2 diabetes, especially in someone who is not overweight and has no family history of diabetes, or a sudden change in blood sugar control in someone with existing diabetes, can sometimes be an early clue to pancreatic cancer. Blood clots. In some cases, pancreatic cancer can increase the risk of blood clots, particularly in the legs or lungs. It is crucial to reiterate that these symptoms can be caused by many other conditions. However, if you experience any of these symptoms, especially if they are new, persistent, or worsening, it is vital to see a doctor promptly for evaluation. Do not dismiss them, even if they seem vague. Identifying those at risk. Key risk factors. While the exact cause of pancreatic cancer is not definitively known, research has identified several factors that increase a person's risk of developing the disease. Some risk factors are modifiable, while others are non-modifiable. Non-modifiable risk factors include age. The risk of pancreatic cancer increases significantly with age. Most diagnoses occur in individuals over 65, with the average age of diagnosis being around 70. Sex. Men have a slightly higher risk of developing pancreatic cancer than women. This may be partly linked to higher rates of smoking in men historically. Race. In the United States, African Americans have a slightly higher incidence of pancreatic cancer compared to other racial groups. The reasons for this are not fully understood, but may involve a combination of genetic and socioeconomic factors, as well as higher rates of other risk factors like diabetes and smoking. Family history. Having a family history of pancreatic cancer increases your risk. The risk is higher if you have a first-degree relative with the disease, and the risk increases with the number of affected relatives. Inherited genetic syndromes? Certain inherited gene mutations and genetic syndromes are associated with an increased risk of pancreatic cancer. These include BRCA1 and BRCA2 mutations, also linked to breast and ovarian cancers. Lynch syndrome increases the risk of several cancers, including colorectal and uterine cancer. Familial atypical multiple mole melanoma syndrome, associated with a higher risk of melanoma and pancreatic cancer. Hereditary pancreatitis, a rare inherited condition causing chronic inflammation of the pancreas, which significantly increases the risk over a lifetime. Peutz-Jeghers syndrome, a rare disorder causing polyps in the digestive tract and increasing the risk of several cancers, including pancreatic cancer. PALB2 mutations, also linked to hereditary breast cancer. Genetic counseling and testing may be recommended for individuals with a strong family history of pancreatic cancer or a known inherited genetic syndrome. Potentially modifiable risk factors include smoking and tobacco use. Smoking is one of the strongest modifiable risk factors for pancreatic cancer, roughly doubling the risk. The risk decreases after quitting, but remains elevated for many years. All forms of tobacco use, including cigars, pipes, and smokeless tobacco, increase risk. Diabetes. Long-standing type 2 diabetes is associated with an increased risk of pancreatic cancer. As mentioned earlier, new-onset diabetes in older adults can also be a symptom. The relationship between type 1 diabetes and pancreatic cancer risk is less clear. Chronic pancreatitis, chronic inflammation of the pancreas increases the risk of pancreatic cancer. While heavy alcohol use is a common cause of chronic pancreatitis, other causes exist. Obesity. Being overweight or obese is linked to an increased risk of pancreatic cancer. Carrying excess weight around the waistline may be particularly relevant. Heavy alcohol consumption. Heavy and long-term alcohol use is a major cause of chronic pancreatitis, which in turn increases the risk of pancreatic cancer. Some studies also suggest a direct link between heavy alcohol consumption and pancreatic cancer risk, independent of pancreatitis. Exposure to certain chemicals. Heavy occupational exposure to certain chemicals, such as those used in dry cleaning and metalworking, may be associated with an increased risk. It's important to note that while these factors are associated with an increased risk, many people with these risk factors never develop pancreatic cancer, and some people diagnosed with the disease have none of the known risk factors. Treatment challenges and approaches. Pancreatic cancer is known for being aggressive and often resistant to treatment. Several factors contribute to the challenges in treating this cancer. Late diagnosis, as discussed. The late stage at which many pancreatic cancers are diagnosed significantly limits treatment options and makes a cure less likely. Aggressive biology. Pancreatic cancer cells tend to grow and spread rapidly. Tumor microenvironment. Pancreatic tumors often have a dense, fibrous stroma that can make it difficult for chemotherapy, drugs, and immune cells to reach the cancer cells effectively. Metastasis. Pancreatic cancer has a high tendency to spread to distant organs, even when the primary tumor is relatively small. Limited effective systemic therapies. While chemotherapy is a mainstay of treatment for advanced disease, its effectiveness can be limited, and resistance to chemotherapy can develop. Despite these challenges, research is ongoing, and treatment strategies are continually evolving. Treatment plans are highly individualized and depend on the stage of the cancer, the patient's overall health, and the specific characteristics of the tumor. Treatment options for pancreatic cancer include surgery. Surgical removal of the tumor offers the best chance for a long-term cure. However, due to the late diagnosis, only a minority of patients are eligible for surgery. The type of surgery depends on the location of the tumor. Whipple procedure. This is the most common surgery for tumors in the head of the pancreas. It's a complex operation that removes the head of the pancreas, the duodenum, the gallbladder, and part of the bile duct. Distal pancreatectomy. This surgery removes the body and tail of the pancreas. Total pancreatectomy. This involves removing the entire pancreas, which leads to both diabetes and the need for lifelong enzyme replacement. Even after successful surgery, the risk of recurrence is high. Chemotherapy. Chemotherapy is a systemic treatment that uses drugs to kill cancer cells throughout the body. It is a primary treatment for pancreatic cancer that is spread or when surgery is not possible. Chemotherapy is also often given after surgery to kill any remaining cancer cells and reduce the risk of recurrence. In some cases, chemotherapy may be given before surgery to try to shrink the tumor and make surgery possible or more effective. Common chemotherapy regimens for pancreatic cancer include FOLFIRINOX and gemcitabine-based regimens, sometimes combined with other drugs like nab-paclitaxel. The choice of regimen depends on the patient's health and the cancer's characteristics. Radiation therapy. Radiation therapy uses high-energy beams to kill cancer cells. It is often used in combination with chemotherapy for locally advanced pancreatic cancer that cannot be surgically removed. Radiation can help control local tumor growth and alleviate symptoms like pain. It is less commonly used for metastatic disease. Targeted therapy. Targeted therapies are drugs that focus on specific molecular abnormalities within cancer cells. While targeted therapy has revolutionized the treatment of some cancers, its role in pancreatic cancer has been more limited. However, for patients with specific gene mutations, such as BRCA mutations, targeted therapies like PARP inhibitors may be an option, particularly for maintenance therapy in metastatic disease. Genetic testing of the tumor and the patient is important to identify potential targets. Immunotherapy. Immunotherapy aims to stimulate the patient's immune system to recognize and attack cancer cells. While immunotherapy has shown significant success in other cancers, it has not been as effective for most pancreatic cancers as a standalone treatment. Research is ongoing to explore ways to enhance the effectiveness of immunotherapy in pancreatic cancer, perhaps by combining it with other treatments or by targeting the tumor microenvironment. Palliative care. For many patients with advanced pancreatic cancer, the focus of treatment is on managing symptoms, improving quality of life, and providing supportive care. Palliative care plays a crucial role in addressing pain, digestive issues, nutritional needs, and emotional support, improving outcomes. The importance of research and early detection efforts. Despite the challenges, there is hope. Research into pancreatic cancer is accelerating, focusing on better understanding its biology, identifying new therapeutic targets, developing more effective systemic therapies, and improving methods for early detection. Efforts to improve early detection include identifying higher-risk individuals who may benefit from surveillance programs, as well as research into new biomarkers that could indicate the presence of early-stage cancer. A multidisciplinary approach involving a team of specialists is essential for optimal pancreatic cancer care, from diagnosis through treatment and supportive care. Participation in clinical trials is also an important consideration for many patients, offering access to promising new therapies. Conclusion: pancreatic cancer remains a formidable disease, often diagnosed at a late stage due to its elusive symptoms. Understanding the subtle warning signs, recognizing the risk factors, and being aware of the complexities and ongoing advancements in treatment are vital. While the challenges are significant, the dedication of researchers and clinicians is leading to a deeper understanding of this cancer and the development of new strategies. For individuals with risk factors or concerning symptoms, prompt medical evaluation is paramount. Through increased awareness, continued research, and a focus on early detection, we can strive to improve outcomes for those affected by pancreatic cancer. Thank you for joining us on HealthSphere. Stay informed, advocate for your health, and support efforts to combat this challenging disease. This video provides general information and is not a substitute for professional medical advice. Always consult with your doctor for diagnosis, treatment, and personalized recommendations regarding your health situation.